Hi, my name is Telesava Singha. Today I'm going to talk about the effective communications in health and social care. Okay. The objectives of today's sessions are the definition of effective communication in health and social care. At the end of this session, you should be able to define the effective communication in health and social care. Secondly, you should be able to describe advantages of effective communication. Thirdly, you should be able to emphasize the important communication skills for leaders. Now tell me, what is the effective communication in health and social care? Actually, the effective communication in health and social care is the exchange of clear information and instructions on care needs, the provision of direct or indirect emotional support to patient or colleagues. Actually, it will help to develop a positive relationship. All right. If we describe it further, the effective communication is defined as the ability to convey information to another effectively and efficiently. All right. Now let's move on to the advantages of effective communication. Actually, the advantages of effective communications are, the first one is trust, the second one is understanding, and the support, so that they can make the service user feel as comfortable as possible. Okay, what are the important communication skills for leaders? The first one is listening, the active listening. Think about that. As a nurse leader, you are working. Okay, the nurse called Sarah is coming to you and she wants to tell you something. Now you are listening while you are writing something, and while you are writing, you tell Sarah, yes Sarah, tell me. Then Sarah is telling you something, but you are not looking at her face, or no, you are not looking at her eyes, and you are still writing. And after she finished her work, what does she feel? She feel my leader doesn't care me. Yes, of course, it's true. But think, if when Sarah comes to you, if you can look at her face, if you can look at her eyes, yes, Sarah, tell me, what do you want? What do you want me to tell? Do you want anything from me? Yes. Then Sarah will tell you something, and the Sarah will tell everything she wants to tell. And after she finish, she feel she feels that my leader cares me a lot. So that is active listening. The second one is complimenting. People work for more than their pay. They want to be noticed and praised for their work. So you think you start your work at 7 o'clock and end your work at 1 o'clock. During these 6 hours, what kind of work you are doing? You provide medications, you provide or IV injections, and you provide health education to your friends, to your clients and their family members. You do admissions, you do discharges procedures, you do lots of work during this work during this period. But while you were doing your work, when the leader comes to you and when she tells you that, oh, Sarah, you have done lots of works today, it's awesome, you're fantastic. What do you think? You feel happy. You feel happy because your leader praised you. Because your leader appreciate your work. So what will happen? Sarah will think to work hard in the future. The third one is delegating tasks clearly. Different people have different qualities. So, as a leader, you have to identify their skills, you have to identify their task, you have to identify their qualities. So, according to your skills, you can deliver work tasks for them. If you identify somebody as a creative person, you can identify them as a quality nurse. If you identify somebody as who have good communication skills, you can delegate her as a reception nurse. Of course you can. The fourth one is managing meetings. You can manage uh, with meeting a monthly and a weekly meeting to share your thoughts and ideas. While you were managing meetings, you can talk uh, in a nice way to your colleagues. And the last one is positive verbal and non-verbal communication skills. During this COVID outbreak, you are wearing a mask, but your mask covers only your nose and mouth. It doesn't hide your eyes. Eyes talks. Okay? So while you are smiling, your eyes shows it. While you are in a grumpy mood, your eyes shows it. Yes. So you have to keep verbal and non-verbal communication skills. All right, okay. If you have any questions you would like to ask, I'm here to answer them. If you don't have any questions, I would like to thank you. Thank you for your participation and thank you for your valuable time.